Well, good morning, everyone, and thank you all for being here. I want to start off by thanking my fellow co-chairs, Congressman Bacon from the great state of Nebraska, Congressman Beyer from the great state of Virginia, and Congressman Gonzalez from the great state of Texas, who unfortunately he could not join us today. It is an honor to co-lead this caucus with all of my colleagues in a bipartisan fashion. I'm also so grateful to the advocates who have joined us here today. Your partnership and perspectives are incredibly valuable to the work we do as a caucus, and I want to thank you for your continued support. I'm Congresswoman Andrea Salinas from the great state of Oregon and help to co-chair with my colleagues the Mental Health Caucus. 1 in every 5 American adults, or about 23% of the population, struggles with a mental health disorder. At the same time, about 17% of Americans are suffering from a substance use disorder. This is a crisis that impacts all of us, regardless of age, gender, religion, cultural background, or political beliefs. In fact, many of us have either known or loved someone, or they themselves have struggled with a mental illness or addiction. For me, it was my sister. Growing up, I watched her struggle with depression and suicidal thoughts, which eventually led to suicide attempts when she was just a teenager. Unfortunately, mental health was something we just didn't talk about in my Latino family. That kind of stigma is one reason many Americans aren't getting mental health care that they need and deserve, along with cost, provider shortages, lack of information about available resources, and so many other barriers. And this is where we come in. The Mental Health Caucus exists to raise awareness, reduce stigma, share resources with our constituents and people across the United States, and most importantly, pass legislation to make mental health services more accessible and affordable for all Americans. This Congress, we have almost 100 members and counting from both sides of the aisle and from districts from across the country. That is because mental health is an issue where bipartisan consensus is still possible. I remain very hopeful. We've seen how these problems have affected our own families, neighborhoods, and communities, and we all share a similar goal: putting an end to the mental health and addiction crisis once and for all. I want to give my colleagues enough time to share their thoughts, so I'll leave you with this. I'm optimistic and excited about the road ahead because we have partners, parents, providers, and yes, even politicians who want to see change and are ready to roll up our sleeves and get to work on common sense solutions. Together, we will build an America where everyone can access the quality, affordable mental health care they need. And now I'd like to yield to my friend and colleague from Nebraska, Congressman Don Beyer.
Thank you. Sorry, good. Look, I'm Don Bacon. The handsome guy behind me is Don Beyer. I thank Congresswoman Salinas and all the co-chairs. I appreciate those who share your expertise so that we make good decisions. You know, I served in the Air Force for 30 years. You got to solve problems. And the first way to solve something is to identify what is the problem so you know how to fix it. Well, we do have a mental health crisis in our country. And I think it's pretty clear to all of us that we have underfunded the mental health care. Now, what happened? Several decades ago, we walked away from institutionalized mental health care, and that money did not make it to outpatient care, right? So we have a shortage. That money got shifted away and was not put back into mental health. That's just the fact. So we realized we're underfunded. So since I've been elected 9 years ago, I've been working to improve mental health for students. Put it in your schools. Those healthcare specialists, our law enforcement, our military, correctional officers. That's a tough job, and I can just look at a lot of these different professions where they needed more help, and they're serving us, and we owed it to them to have their backs on this and help them there. And like Congresswoman Salinas, I have my own story. You know, my dad remarried when I was 15. And my stepmother, she had mental illness. It was like 2 days in heaven and 1 day in hell. And we did that for, until I went to college. And they had 4 kids. I had 4 brothers and sisters from my original mom and dad. But of the 4 kids in the second family, 3 of them also have had mental health, and they're not alive today. And they're younger than me. And so I've seen it firsthand. I've also seen it in the Air Force with post-traumatic stress and other areas where we need help. And obviously, I've seen it in the 9 years I've been in Congress where the needs are there. So I look forward to working with our co-chairs and all of you to improve our mental health capabilities in this country. We know the problem, and we know the problem. That means we can find the solution. Thank you. Thanks for your leadership.
Thank you.
I'm Don Beyer from Virginia. I want to welcome you to the Don Caucus. And I'm so thrilled with General Bacon and Congresswoman Salinas' leadership. We don't have Congressman Tony Garcia from Texas with us today, but it's Gonzalez rather. But it's terrific that it's 2 Democrats and 2 Republicans, because as I said, it affects every American, and we want this to be the largest caucus on the Hill. We should have every Democrat and every Republican in it, because every family, if you look just hard enough, you'll find that they're dealing with some kind of mental health concern: anxiety, depression, suicide ideation, bipolar, schizophrenia, on and on. And I think we all agree that the health system is failing. Tony and Andrea and I yesterday were part of a mental health roundtable with a number of adolescents who suffered it. And there was no good news coming out of that. Their experiences were just tragic. This caucus was founded in 1999 by Grace Napolitano, who stayed into her 90s in order to chair it. And we want to honor all of her long work, because we have 1 in 11, every 11 minutes, someone dies from suicide. We had 50,000 deaths by suicide last year in the United States. It's a 36% increase from 2000. 20% of high schoolers considered suicide ideation in the last year. 16% actually made a plan. 9% actually made an attempt. It's the second highest cause of accidents for youth, second highest cause of death behind accidents. It's just completely unacceptable. John Katko, another great Republican, and I started the suicide prevention working group 10 years ago, and along with, in a bipartisan way, we've made a lot of progress. The 988 number, double the number of calls in the last year from pre-988. We'll keep working on the suicide campaign to educate people about how to deal with suicide. A lot more on campaign barriers to suicide, making sure that we have nets on the bridges. But there's so much more that we can do. I too come at this very personally, not going through all the family mental health issues, but my oldest, my son, was diagnosed with schizophrenia 31 years ago. He's almost 50, which is a great blessing, through various suicide attempts, many hospitalizations, the occasional jail cell. I end up knowing far more than I'd like to know about schizophrenia. But let me give you the latest Fuller-Torrey numbers, that right now there are 600,000 individuals with schizophrenia in our jails and prisons. Our incarceration system is largely what we deal with the difficult mentally ill. We have another 600,000 that are homeless. If you go to homeless anywhere in America, they're largely people with either substance abuse problems or overwhelmingly schizophrenia. We do a very poor job at dealing with serious mental illness in this country. And that's why I'm so grateful that my colleagues, Andrea, Don, Tony, and the many, many other Dems and Republicans who signed up to be part of this, have come together with our mental health professionals and our industry leaders to really try to make a difference. So thank you so much for being here. Let me give it back to our co-chair.
All right, and now we'll be hearing from some of the professionals and advocates on these issues.
Okay. And thank you and good morning. I'm Dr. Teresa Misquimen Rivera. I'm the current president-elect of the American Psychiatric Association. It is an honor to be here and call attention to such an important issue, as you've heard already. I really thank Representatives Andrea Salinas and her co-chairs, Representative Don Bacon, Don Beyer, and unfortunately he's not here, Tony Gonzalez, as well as all the members of the Congressional Mental Health Caucus for their commitment to the advance of mental health for all Americans. As you know, we live in a country that absolutely, we continue to have difficulties with the opioid epidemic. We live in a country where suicide, as you heard already, remains as a leading cause of death, and where we face a crisis in child and adolescent mental health. But we also know that solutions that could absolutely save lives are well within our reach. That is why the work of this caucus is so crucial. And as you've heard today, mental health is a bipartisan issue, and this particular caucus is a testament to that particular participation. And I really thank both sides of the aisle to be here today for those of us that need help not only to treat our patients, but also the families and the individuals that we serve. We've seen numerous legislative victories led by this particular group, including those that will absolutely improve the way that the psychiatric workforce is developed. In addition, that have made and allowed patients to actually have better access to innovations such as not only telehealth, but also integrated care. I am absolutely excited today to see new achievements and what comes next as this caucus launches in the 119th Congress. At the American Psychiatric Association, we stand ready as a resource to help you guys create not only tangible but viable solutions for our country's mental health. Thank you for being here, and I now yield to Mike. Thank you.
Thank you so much, Doctor. Good morning, everybody. My name is Michael Linsky, and I'm Director of Congressional Affairs at the National Alliance on Mental Illness, or NAMI, the nation's largest grassroots mental health organization. On behalf of our 650 NAMI chapters across the nation that serve individuals and families affected by mental illness, and the 1 out of 5 Americans that will face a mental illness each year, I want to say thank you to all the members of the Congressional Bipartisan Caucus, but especially our outstanding co-chairs. The mental health community is so grateful to all of you for what you're doing. Representative Beyer, you've been a longtime champion for suicide prevention and one of the nation's leading voices on 988. Your actions have saved lives. Representative Bacon, a bipartisan leader who has worked to ensure that our service members and veterans have access to the mental health care that they deserve. Congresswoman Salinas, your dedication to ensuring that individuals not only have access to care, but that we're able to address our workforce shortages is making a huge difference in the lives of Americans all across the country. And of course, Representative Gonzalez's work to ensure that our schools and our school children have the mental health resources that they need is changing lives of children and families all across the nation. So on behalf of NAMI and all the families affected by mental illness and their loved ones, I want to thank the caucus, let them know that NAMI and the entire mental health community is here with them to help in any way that they can, and that we look forward to working with you to help reform the system. Thank you so much, and my good friend Laurel Stein.
Thank you. Thank you, Congresswoman Salinas, Congressman Bacon, Congressman Beyer, and Congressman Gonzalez for coming together as leaders to launch the Congressional Bipartisan Mental Health Caucus in the 119th Congress. Good morning, everyone. I am Laurel Stein, and I have the privilege of serving as the Executive Vice President, Chief Policy and Advocacy Officer at the American Foundation for Suicide Prevention, and as the Chair of the Board of Directors of the Mental Health Liaison Group. AFSP is the nation's largest nonprofit dedicated to saving lives and bringing hope to those affected by suicide. And we are also the largest private funder of suicide prevention globally. The Mental Health Liaison Group is a nonprofit coalition of over 100 national organizations dedicated to strengthening America's access to mental health and substance use care. I am pleased to be joined by AFSP colleagues and MHLG partner groups, including the American Psychiatric Association, NAMI, and Mental Health America behind me, standing with us today at the Capitol in Mental Health Awareness Month to applaud your bipartisan leadership and extend our appreciation to your staff, Molly McTaggart, Matthew Douglan, Kate Shigler, and Kelly Chong. The state of mental health and suicide prevention remains a national crisis. Now, I'm going to share some startling and very dire statistics. Suicide is among the 9th leading cause of death for people 10 to 64 years old, and the 2nd leading cause of death for youth 10 to 14 years old. An estimated 13.2 million adults seriously thought of suicide in 2022, and 1.6 million attempted suicide. Furthermore, 1 in 5 individuals experience a mental health condition. And while overdose deaths have been declining since its peak in 2021, it remains a leading cause of death for adults 18 to 44. The caucus is a firm reminder that the doors are open for bipartisan dialogue, engagement, and opportunities, and a path to progress with political will to address the crises our nation continues to face. With these alarming statistics I shared with you earlier on mental health, suicide, and substance use crises. These impact people across the lifespan, children through older adults, and from rural to urban areas. AFSP and MHLG stand ready to serve as a resource to the caucus and your colleagues on the critical investments and research and early intervention, prevention, treatment, crisis response, and recovery policies that can improve mental health, combat suicide, and combat substance use and help save lives. Thank you again for your leadership, and thank you to all your colleagues who have joined the caucus. Thank you very much.
Good morning, everyone. Happy to be here. My name's Tim Clement. I'm the Vice President of Federal Government Affairs for Mental Health America. We're the country's oldest mental health advocacy organization. And first, I want to thank the co-chairs of the caucus, Congresswoman Salinas, Congressman Beyer, Bacon, Gonzalez, for not only reestablishing the Mental Health Caucus, but doing so in such a strong bipartisan fashion. As you've heard so far today, this is a bipartisan issue. This mental health, mental illness, substance use disorder, doesn't care about political affiliation. It's something that we have to address as a country in a bipartisan fashion, and this caucus is doing it. With Mental Health America, we focus on the gamut of issues that affect mental health and substance use disorder, but two of the issues that are most important to us are prevention and early intervention and peer support. Yes, prevention and early intervention, that's a real thing for mental health. You can actually do that. We don't have to wait till crisis, till hospitalization, till it gets to very severe progression. You can prevent and you can intervene early. There's evidence-based methods to do so. So we look forward to working with the caucus to advance legislation that will do that. There's several bills out there that I think will do a great job on that. And peer support. Peer support is something that, yes, when you have a mental health condition or a substance use disorder, obviously you need clinical treatment from a mental health professional, substance use disorder professional, but peer support is also a critical tool to helping people not only enter into recovery, but maintain their journey throughout recovery. So peer support is something that's proliferated greatly for the last few decades, but one thing where it hasn't proliferated, which we really think it needs to, is youth peer support. We at Mental Health America, we do frequent surveys of youth, and that's one thing they tell us over and over again is they want peer support, but they want it from a youth peer. If you're 19, 20, 21, 22 years old, you don't want to have a peer who's 45 years old like I am. You want to have someone who's your age. So that's something that we need to expand youth peer support. There's options under consideration in Congress that would do that. So that's something that we stand ready to work with the caucus to advance those issues and many other issues, including access to care. And I won't repeat any of the statistics you've heard. The situation is dire. We have a crisis. The numbers and trends are alarming. They've gotten worse. And we need to take action now like this caucus is doing. And we stand ready at Mental Health America and with all our colleagues at MHLG and our partner organizations to do that and work with the caucus to make sure that we address this crisis in a way that meets the need of today. So thank you very much, and I will turn it back over to Congresswoman Salinas.
Thank you. Wow, thank you all so much. Thank you to our professionals, advocates, and to my co-chairs leading this mental health caucus. It feels good to kick off in this beautiful sunshine with everyone here. And you've heard a lot of statistics today, but now we have about 10 minutes to answer, specific questions from both the legislators as well as our professionals. Well, the one thing that I've been hearing from providers back home is that big cuts to Medicaid, it's almost $1 trillion. $900 billion is almost $1 trillion. And for our state of Oregon, that would mean severe cuts to those who go through what we call the Oregon Health Plan to get their care. We actually have providers through the Oregon Health Plan that help with mental health and addiction. That is part of our state plan. There are other states who are very similar. So these cuts would mean people will die. People will not have the access to the care that they need to prevent, death by suicide, to prevent what might be an overdose or struggling with addiction. People will see harm. And that is really scary right now. So for me, I can't have a $900 billion reconciliation package that proposes to cut Medicaid at that level, at $900 billion. I shouldn't say the package, but the $900 billion cuts to Medicaid. Don, would you like to say anything?
You said it perfect.
Okay. Don, you want to take this?
They're just moving in the complete wrong direction. We all respect that we want to eliminate waste, fraud, and abuse in government, but the last thing we want to do, as our roundtable yesterday with the adolescents who had all struggled with their own mental health, is there's a huge paucity, a shortage of resources for people with mental health. We invest an enormous amount in cancer research, an enormous amount in Alzheimer's. We do lots and lots of stuff with cardiology. We do very little at the federal level, which spreads down to the states in terms of dealing with their mental health challenges, which ironically face, every family, probably almost every one of us at some time in our lives.
First of all, thank you for being here today. This is exactly what we need. Our young physicians, our young psychiatrists here to make sure that our voices are heard and to keep hope. We are trained, we are highly educated in terms of mental health, diagnosis, treatment, and prevention. That is what we need. And with the help, of course, with a bipartisan caucus that will advance the mental health of America. So thank you for what you do. Thank you for not only for what you do for your patients, but for your community. Thank you.
And I'll just add, I have actually a couple of bills to address the mental health workforce shortage. One that would provide scholarships on the front end. For myself, I was a psychology major at the University of California, Berkeley. I thought I would be a clinician, actually. But I went through, years paying for school myself. I didn't graduate with any debt, and I was really happy with that, proposition when I got my degree. And then I looked at what graduate schools would cost and what that continuing education would mean for me, and I decided against it. Right? We also have a loan forgiveness bill out there that would help folks on the back end who have encountered debt on the back end. So there are lots of ways and opportunities that we can help build the workforce shortage, because we know that those of you who are already in the field or seeking careers need the cavalry to come in. You can't do this work alone. We have a shortage right now. It is very apparent, and we need more resources. So thank you for your question.
Let me just very briefly add, as long as medical school is so expensive and you bear so much medical school debt, you're going to end up wanting to be an orthopedic surgeon. And what we need are more family practice who are the first line of defense against mental health, for mental health, but then all the young psychiatrists too.
Do you want to take this?
Shoot.
Yeah, okay. Here's what I would say. So we heard yesterday, and actually we had a great panel, again, bipartisan yesterday afternoon with some young people, adolescents and teens who came around a stakeholder table essentially and talked about their own experiences. And Congresswoman Bonamici was there. She works on the Education and Workforce Committee. And, she asked the question, how does social media and how does technology affect your mental well-being? And would any of you actually be opposed to dropping your devices off at the, the entryway to the schools? And none of the kids there, who had all had traumatic experiences, were opposed to that idea. But there needs to be more, right? I mean, let's be honest, this is not enough. And I feel like as a mom, and I will just say this right now, my daughter last night at college called me at about 11 o'clock. She witnessed a suicide on her college campus. And she said this gentleman had been bullied and harassed. And so what I would say is that there are ways that we can prevent this from happening, and I think our professionals talked a bit about that. But to some degree, I feel like we do need to make these devices, we know from research, we heard from a psychiatrist yesterday, do cause harm. And we are seeing a difference in the mental illness of our children. And like any product, shouldn't there be some form of help and compensation for that harm that they are causing? So we absolutely have to get back to that conversation and have it robust. Parents are included in this. Parents are really pushing for this right now, and we have to take a closer look. Thank you.
And as Congresswoman Salinas said, there are good bills. There's a wonderful digital literacy bill, starting with kids, first grade, second grade. But overall, we need major societal change. This is a country where America bowls alone. Loneliness is a huge crisis. More of us live alone than ever before. We come to understand that happiness and flourishing is being part of a sense of community. I'm trying to kind of teach my kids to pick up the telephone and call, which the next generation doesn't tend to do. That it's all about reconnecting as human beings that will give us that sense of belonging.
All right, I think we're just about ready to wrap up. I want to thank everyone again, all of our wonderful professionals and advocates for being on the Hill this week, and this is just the start. Thank you.